States and across the nation. But in the early months, the data was not very transparent. It was not very clean. It was not very easy to use. And so they've done a lot of work, get it ready and clean, so we have a good and clean and reliable data. And then the kind of sister project with the racial data trackers trying to kind of unearth inequities as they're happening. The other kind of piece around data is what we know about at least structural racism and certainly racial inequality, economic inequality, is that even when we intervene on one form of racism or economic inequality, like it's just going to Frankenstein and morph into another inequality, right? So intervene on, for example, educational segregation, right? We did during civil rights, right? We intervened on that. We mandated and integrated schools. We had integrated schools for a long time. It morphed into now we have this really Frankenstein public education system with, private education, this charter school thing that's publicly funded but privately ran, really poor public schools. And so now we have just as racially segregated schools as we did back in the 50s. It's just a different way now, right? But if we didn't have the data to follow that and see that, we wouldn't be able to understand inequity as it happens again and again and again. And so I think we do need data to monitor and track and think about all of this stuff that's happening around us at all times. Because if we lose sight of it and we don't pay attention to it, it's going to happen again and again underneath our nose. What I hope and what I think is in this next kind of generation of population health researchers that I'm a part of and that I've been trained in is not just science for science sake and research for research sake, but disseminating our work and doing these things like podcasts and webinars and policy conversations and working with community organizers and writing op-eds. I've been seeing more and more and more in that of my generation of researchers and folks like you coming up so that we can really arm people with the best, right? Harness science for the best that it can be as opposed to the bad. So, or the science just for, academia's sake. And so I think more academic environments and missions are recognizing that piece of science and helping those of us who are early on in our careers get tenure in appreciation of that work. So
it was lovely to have you, and we hope that you have a great rest of the day.
Thank you.
Thank you again.
Teeing up for fall quarter. I know it's going to be an interesting year, so I hope you all stay safe, and thank you for having me.
Kinda Sort of Activated. Where do we go from here?
For Kinda Sorta Activated, we kind of split this into two parts because I think when we talk about medical racism, it's a huge topic, and if you're not in the medical field, you can ask yourself, what can I do? But I think the overarching theme something that we've talked about back in our KST was the aspect of implicit biases. And this is something that, again, everyone has, and how we can change those is through educating yourself. And if you have the capacity, and I can't stress that enough, if you have the capacity, you help others to do the same, whether that be in your own family, your friends, communities, spaces that you're involved in, or even if you see something happening in your daily life walking across the street. If you have the capacity to change someone's implicit bias and how they react, that should, and hopefully you can put that on yourself. But again, we ask, how can we make implicit bias training across the board something that is not a question for the medical industry? Broadening education is not only important in history classes, but also in science curriculums to teach the research and also teaching ethics. We can't understand why you wouldn't include why you wouldn't include this kind of education in someone who is going to be treating every type of person, every kind of person. No matter their background, you're still treating them and giving care. The word care is so important. And just as we see the importance of learning, the double helix model is just as much as learning about the experiences that bring that person and who they are.
On that note, we've been talking a lot about educating ourselves and those around us, but after obtaining this education, what we can really do is to mobilize it. And we can do this through advocacy, activism, and even promoting health education in our schools. UChicago Students for Autumn 2020 Remote Learning is a group that is petitioning for UChicago to go fully online this upcoming fall quarter. If you're interested in participating in this movement, there are several members of the group that are posting on Facebook and Instagram, promoting the petition and asking for signatures, so this is definitely something you can do. Another person doing wonderful work in the community of Chicago is Dr. Katina Latham, who's worked with the Urban Health Initiative and Community Health Needs in the South Side. And one of the organizations that she's on the board of is the Girls Like Me Project, which pushes to overcome these institutional barriers of health inequity to create opportunity. It connects African American girls age 11 to 16 to a strong sense of self-efficacy and awareness, and encourages them to become agents of change for social good. There's a link up on their website right now, so you can sign a young woman up if you would like. You can also volunteer with the COVID-19 Tracking Project, which aids with the data collection and analysis that allows us to disseminate this big picture health inequity information. The Interdisciplinary Association for Population Health Sciences, or IAPHS, looks at health according to location. It taps into a multi-level approach to address the interplay of environment, individual behavior, and genetics with policy, clinical care, and intervening actions, and seeks ways to alleviate health risk factors. This is one way you can promote education of others, and it also works with the Robert Wood Johnson Foundation to promote health equity through health action. One last organization that Dr. Aresha Martinez-Cardoso actually put us onto is called Mi Gente, where the J stands for justice. It's a political home for Latinx and Chicanx people who seek racial, economic, gender, and climate justice. It is pro-Black, pro-Indígena, pro-worker, pro-mujer, pro-lesbian, gay, bi, trans, and queer, and pro-migrant, because they hold all of these identities. This organization helps people do this through campaigns, connects people across a wide network, and serves as a hub for culture, learning, and advocacy. They're also dedicated to health justice, so if this is something that you're interested in, I would definitely check out the website.
Thank you everyone for tuning in to Kinda Sorta Brown, episode 2, our COVID episode. Thank you Dinah, John, Chase, Hope, and Daisy for being an amazing speaker with me and researcher on this podcast. Go ahead and please follow us on our social medias at Kinda Sorta Brown, and listen and tune in for our episode 3, where Hope is going to give us an amazing episode on texturism.
Thank you, Lena, for starting this outro for us. I have been one of your hosts, Daisy Okoye, the content creator for Kinda Sorta Brown. Thank you for listening all the way through if you did. And as we always say, claim it.